Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Ludwig's angina. Ludwig's angina is a severe, rapidly progressing bacterial infection of the floor of the mouth. Floor of the mouth means the area underneath the tongue and often involves the submandibular, sublingual, and submental spaces. It can cause significant swelling, which may obstruct the airway and becomes life-threatening if not treated promptly. Causes typically it is a polymicrobial infection involving both aerobic and anaerobic bacteria. The most common initiating factor is a dental infection, especially of the second or third molar, particularly second and third molar teeth of the lower jaw. Other possible causes include trauma, oral surgery, and other infection in the head and neck region. So not only lower jaw, upper jaw teeth infection may also cause Ludwig's angina. Symptoms of Ludwig's angina: rapidly spreading swelling and induration of the neck and floor of the mouth, pain and tenderness in the affected area, difficulty swallowing dysphagia, difficulty speaking dysphonia, or hot potato voice. Difficulty breathing, idea is that the tongue is pushed up and backward that may obstruct the airway, and this problem, difficulty breathing, which may require immediate attention like tracheostomy. There will be fever and general malaise. So these are the features of Ludwig's angina. So this is an image from Google. We are seeing a form of cellulitis or connective tissue disorder that affects the submandibular, sublingual, submental spaces here. There is the area under the tongue and the neck area here. Tongue is pushed up and backward. The genuine muscle is shown here, sublingual space. Okay, here the mylohyoid muscle separating the sublingual and submandibular space. And there will be collection pass is possible here. Diagnosis: clinical evaluation is often sufficient in advanced cases because we got the swelling, dysphagia, dysphonia, hot potato sign. These are the features. We can diagnose it. History of teeth infection, history of oral surgery, trauma to the oral region. Okay. So clinical evaluation is often sufficient in advanced cases. Imaging such as CT scan or MRI may be used to assess the extent of the infection and rule out abscess formation. So this is the imaging study of the Ludwig's angina here. We are seeing the swelling collection here. Okay. Treatment: always we have to maintain ABC, airway, breathing, circulation, airway management. This is the first priority since swelling can lead to airway obstruction. Endotracheal intubation or tracheostomy may be required in severe cases. Antibiotic, we should be generous regarding antibiotic. We can give both gram positive, gram negative antibiotic, and also anaerobic infection controlling metronidazole, like broad spectrum antibiotic targeting both aerobic and anaerobic bacteria are initiated. Often intravenously common choice include ampicillin, sulbactam, clindamycin with ciprofloxacin, or metronidazole, carbapenems in severe cases. So we may use more than one antibiotic simultaneously, covering the gram positive, gram negative plus anaerobic infection, like we can use the metronidazole. Okay, so we got that, but we need surgical intervention. It may be required. If there is collection of pus, incision, and drainage may be necessary if abscess is present. Abscess means localized collection of pus. Early consultation with a maxillofacial or ENT specialist is recommended. Supportive care, hydration, and pain management. Monitoring for complications like sepsis or mediastinitis. Prevention, prompt treatment of dental infection is important to us. Good oral hygiene to reduce the risk of infection. Ludwig's angina is a medical emergency. You have to know that. So patient should be sent to the emergency room as early as possible so that the appropriate treatment may be done in the hospital setting. That's all about Ludwig's or Ludwig's angina. Again, this is an emergency, so it should be managed very promptly. It may cause breathing problem, dysphagia, dysphonia, and there may be respiratory obstruction, may lead to death. So it should be managed properly. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.